You're listening to the Flex Success podcast, where we teach you how to be less shit.
I'm your co-host Lizzie, and this is Dean. We'll be covering all topics relating to health, fitness, and bodybuilding.
Join us as we use our in-the-trenches experience and up-to-date science to provide you with information that you can actually use.
If you like what we do, be sure to give us a like, follow, share, and tag us on social media. Guys, we are so pumped to kick off the year with our very favourite guest. I believe this is appearance like 3 or 4 for you.
3, yeah.
Amazing.
She's not speaking on our behalf, by the way. Well, I mean, we should say this to every guest, right? But
that's harsh.
She's pretty close.
No, I'm here for it, even if it's not true. I'm just happy to hear it in words.
I do start every podcast probably with a compliment to the guest, but this is maybe the strongest, and I definitely mean it.
I'll take it.
So Dr. Mike II, Michael Banna, for those who haven't listened to the previous podcast and aren't familiar with you, could you please give yourself a introduction?
Sure. I am Mike. I'm a GP in the NHS in the UK. I work full time in that and also in education in the NHS as well. I really have developed a love of talking a lot about health and fitness, and lifestyle journeys sort of came out of my own kind of journey of behavior change and what I learned along the way. I love mental health, and I just like talking about the really challenging topics that I think we face in the interface between healthcare and health and fitness, which is, I think, my biggest surprise when I went through my own behavior change was figuring out that like the health and fitness industry is just a totally different place to healthcare. And I don't know why that is, and why it's not why it's not integrated as much as I think it should be. And so I like talking about the topics that I think people from within those industries can often butt heads about, and trying to help us find common ground.
Love it.
Yeah.
And today we wanted to get a doctor's perspective on kind of the intersection between the health and fitness industry and healthcare. And who better to bring on than a GP himself, and somebody also who I find you have this ability, I haven't met anyone else that does this as well as you, to talk about a really complicated topic that might be covered in shame or stigma, is super nuanced. And you just have this ability to like give one paragraph and kind of capture everything that's going on without people feeling like they're being personally attacked, but still saying, no, you do though. You've always been so amazing at that.
Thank you. I mean, I think it's because I've been around long enough and I've been wrong enough times about enough things that I think that I think the most important quality that you can remember when you're trying to explain things to people is humility and understanding that everybody is on different parts of a journey. It sounds a bit wanky to say it like that, but what I mean is like at different stages in my own behavior change journey, I believed loads of different things that I no longer believe. And I think realizing that you've been wrong about those things helps you to understand why some people believe those things, because you remember why you believed those at some stage, and understanding, also remembering how confronting it was when people were condescending or insulting when they tried to explain to you why the thing that you were doing wasn't perhaps as helpful as you thought it might be. And so like I just think it's really important for me to try and do things without judgment. And it can be really difficult, particularly I think in the world of social media, because everybody is so insulting a lot of the time now. I had an experience recently where I commented on a post that was about menopause. And I was sort of trying to get some nuance into this comment and basically saying, look, there are some concerns about some of the stuff that's been mentioned in this post. And I think it's reasonable for some people to be worried about these things because there is some evidence to suggest there are concerns. I think we need to keep it in perspective. It was a pretty mild comment. And I made a pact with myself that I would only respond back to comments on my comment that were respectful or polite. And I wouldn't respond to any that were rude. And I got, I think, hundreds of comments on that, on my comment on somebody's post, and not a single one of them didn't include some sort of insult, whether it was calling me doctor in inverted commas, which I think is the most passive aggressive thing you can ever say to somebody, or, just saying, things like, I suggest you do a bit more research, like just really patronizing, nothing really, just, nothing constructive. And it was a shame because I'm totally open to being wrong and being told that I'm wrong, but I don't need to be spoken to like a 5-year-old. And I think that I should afford that courtesy to everybody else, and not everybody does that. So it's quite hard not to clap back sometimes and be insulting back to people. And sometimes I do that.
Because no, but you see this on both sides of the fence, right? So you have people now that are reducing the, I suppose, the extent in which that the term doctor comes with.
Mm-hmm.
And they are doing this inverted comma business, like, oh, a doctor. And like I see this in the bodybuilding space, like, don't see a doctor. Like they're the worst kind of person, as if to say they can't provide you healthcare.
Oh, let's talk about where that comes from later.
But then secondary to that too, then there's also the doctor that can say, because you have no doctor next to your name, you know nothing.
Absolutely.
And it's humility from both sides that we need to try and like learn to come together with.
Yeah, totally. And it's incredibly frustrating. And I think, again, when I started in this space, like you kind of come happily into these spaces assuming so many things, and in the same way that you might make assumptions about people in other industries, you also make assumptions about people in your own industry. And I'll be assuming that all of the other doctors on social media will behave in a similar way to how I might behave, and they will uphold the standards of professionalism that I think are important to uphold. But again, social media is a great mirror and a great magnifier glass to where you can find that actually your assumptions aren't true. And I got called out by a neurologist in America a couple of days on Instagram for being quote unquote just a GP. And so I was like, oh, come on. And this is somebody that qualified as a doctor less than 5 years ago and is basically throwing their weight around and trying to say that they know everything because they've done 4 years of specialism in neurology. And it was so rude and so arrogant. And I just thought, God, patients are watching, people are watching. And I didn't engage with it further than a slightly sarcastic comment of like, I hope your knowledge is better than your communication skills. But in reality, there was so much that was problematic about that. And you think, if that's how people are conducting themselves on social media, how are they treating patients? If they hold their colleagues in such disregard, and other people's knowledge in such disregard, how are they treating their patients? And I find that really concerning. And I think that I try and remember that when people post about bad experiences that they've had with doctors, it's really hard for the ego not to kind of try and not to just immediately take that personally and to want to go, to want to defend the doctor, because that you've potentially been in a situation where patients may have had a bad experience with you and may have perhaps interpreted something that you said negatively, and it can be really hurtful and really confronting. And I then feel sorry for the doctor, but then I have to remember that that's not my experience. It's not me. It's this person's experience. And, I don't want to then also gaslight them and by just assuming that everybody else has good intentions, because actually, as we know from that social media space, not everybody does have good intentions, and not everybody who has doctor in front of their name knows the things that we might expect them to know, or has the intellectual humility that we might want them to have. And I hear all sorts of things that people say about experiences that they've had with doctors, and you have to be understanding of what the experience was, right?
Can you tell us, Dean, because Mike's painting a picture of people not having great experiences. You mentioned that clients are like, don't listen to a doctor. Can you tell us some experiences that your clients who take performance enhancing drugs might have had with doctors that might justify or kind of explain the attitude towards the medical profession or doctors?
Yeah, I mean, I think it's multifaceted. One, I think there's probably, at least in Australia, I'll speak for Australia, there's a general misunderstanding of what steroids may or may not do. They're just tarnished with a big red flag of do not go near them. They cause problems. And then I suppose the lack of ongoing education on a self-development perspective on a doctor by doctor basis.
Mhm.
I don't expect them to know, but for, we do as a general population kind of just expect a doctor to know everything for some reason. But the experience for me and for my clients usually comes down to this idea that a doctor sees steroid use for some reason as a deliberate attempt to decrease someone's health for no additional benefit. They don't understand whether or not there's a sports performance benefit to it, even just a social benefit, a psychological benefit, a personal preference. And it's there's this weird disconnect between, like, you can have somebody who's addicted to a drug, a recreational drug, and have all of these health consequences, and the person is like, I would like to help you prevent the health consequences, but for a steroid user, they just don't take the steroids then. Like it's really I suppose, like, they diminish the importance of the use of the steroid to the individual, I guess you could say, and just think that it's a very immature approach to personal drug use.
So you've had some clients that have sought out healthcare and they've just been dismissed by the doctor.
Yeah, and this can be in both. It can be a person has enter into a doctor's room that has actual health concerns like blood pressure. Maybe they've got some other issues too, like dyslipidemia or something, right? And they're like, but the cause of the steroids, so just get rid of the steroids, right? Or there is even the client that's like, hey, I understand my behaviors aren't fantastic for my health long term. I would like to discuss some prophylactic medication to maybe even prevent these things from happening. And there's just no. The problem is the steroids, remove the steroids,
which the person isn't willing to do.
Yeah.
So they get no support.
So there's this weird space with steroids. Like, if I went in and said, hey, I'm having a really, I study a lot and I'm having I'm using amphetamine based drugs, or I'm using these and I'm ADHD and I struggle to sleep. They'd be like, here's a sleep medication, But for some reason, there's just not the next step available for people that are recreationally using steroids.
Maybe, Mike, the question then is, for people who have these experiences with doctors where they feel dismissed or shamed and don't really get the help that they need, what might your advice be to them?
So just to touch a bit on kind of what Dean has mentioned as well, it's really interesting to hear that, because I definitely have gone along that spectrum. I would probably say that before I was involved in fitness and before I met people who use steroids and understood a little bit more about it, I perhaps was a bit more like that in terms of my approach. Now, I don't have a lot of experience clinically with steroid users, basically based on my demographic of the kinds of patients that I treat. But in the experience that I had, I remember I remember going, but why don't you just not, you're taking these drugs and they're causing you harm. So why don't you just not do that? And I think everybody as well, I think what's really interesting about, for me, for medical training and medical experience, is that when we become doctors, we are young in the world, we are young in the universe, and we have not traveled, I mean, socially. We haven't met lots of different kinds of people. Mostly we have met our parents, our school friends, and the people that we met at medical school who are also becoming doctors. So, I look back on my early years of medical practice and kind of think I was pretty sheltered actually about a lot of things. And I think it takes a bit of experience to understand how human behavior works. And I think medical school often trains us and teaches us, in a mathematical way, how to fix and help people. But I don't know how much from just doing medical school you can truly understand about behavior change. I think that comes from practice, that comes from meeting patients, that comes from realizing that the way that you give advice is important, the way that you cater that advice to their individual needs. And I think I remember actually really early on in my career, one of my colleagues who actually was earlier on in his training but clearly had a lot more insight than me. We were talking about how you should manage if somebody doesn't turn up for a follow-up. Like, should you contact them? Should you be, if you know that there might be something seriously wrong with this person? And lots of people were saying things like, well, if you need help, you've got to be able to ask for it, you've got to be able to turn up to appointments. There's no resources to be contacting people and doing all of this stuff. It was a slightly wider topic than that, but I remember him like saying, but I guess we have to decide, do we want to help people, Or do we just want to be able to say that we tried to help people? Like, do
Mm.
we
Mm.
actually want to have the positive outcomes where people's health improves and people have longer, happier lives with better quality of life? Or do we just want to tick boxes on documentation so that we can't get sued? So that, so that we can say, well, I did this and I did this and I did this, but they didn't play ball.
Yeah.
Because you can do that or you can do the other. And actually, I think to do the other is a lot more complicated and it does involve understanding how humans work and how humans' minds work. And it's not logical. Of course, the logical thing is that if you're doing something and it's causing you harm and that's the cause of the harm, then cool, stop doing it. But I am always fascinated by the parallels in other forms of stuff. Like a lot of people call for, well, if people smoke, you shouldn't treat them on their NHS. They shouldn't get government funded medical treatment because they've chosen to smoke and they've caused themselves harm. Cool. Well, then does that mean if somebody falls down a mountain skiing or has like a rugby injury that they shouldn't be allowed to have a plaster cast put on that? They should just make their own way home and look after it themselves because they caused that to happen. They
Mm.
absolutely knew that when they strapped themselves to two wooden planks and decided to slide down a mountain, which is an objectively stupid thing to do, then they should have known the consequences. But I think the big difference is that people understand skiing because everyone does it, or not
Mm.
everyone does it, but it's a popular mainstream activity to do. People understand drinking, people understand taking recreational drugs, people understand playing contact sports
Or eating
because they've
food.
grown up
Yeah.
with that being a normal part of life, or eating
Mm.
eating food, exactly. But people do not understand drug use for bodybuilding or for performance enhancing. They don't get it. They don't see why you would want to do that. They don't value the outcomes that you are valuing. And what that really comes down to is, that kind of lack of understanding and a bit of being judgmental and paternalistic, which is, I think, something that's always been a bit of a problem in the medical profession. There is a lot of, well, they continue to smoke despite being given advice not to. And I always hear this about smokers. They're still smoking despite the fact they can barely breathe. How terrible. Cool. What does that tell you about smoking?
Mm.
They know that the reason that they are constantly suffering every day is because they are smoking and they still can't stop. So, how addicted do you think they must be to smoking? How strong must the drive to smoke be for them that it is completely overwhelming the urge to stop, even in the context of extreme suffering and possible death, right? Those are the biggest motivators for anybody, but it's still not working. So, I just feel like we could all stand to have a bit more compassion about it. And so I can't remember what the actual question was because I've just started talking more about what
No, it
people
was
think.
more, I suppose, like how we can address these questions
And
and
How
why
we could, yeah,
doctors
what we
get
should
to the
say.
point that they are dismissive of people.
yeah.
Yeah.
Yeah, exactly. And how can people then approach it? So I think if you're faced with a doctor, I think the thing that I've always found most confronting is when somebody lets me know that I'm missing the mark in
Mhm.
an in a and again, this should never be on it. The onus should always be on the professional to try and do stuff properly, right? So I'm not saying that you should have to treat your doctor this way and you should have to walk on eggshells and all this kind of stuff, because the doctor is the professional in that room. The doctor should be the one who is able to figure it out. But there have been genuine times when I've been missing the mark with a patient and I've not realized that I'm missing the mark. I've kind of thought I was doing the right thing or saying the right thing. Um, and sometimes them saying, like, I feel like you're not listening to me, or I feel like you don't understand why I'm doing this, and I feel like you're judging me, or if actually kind of explaining how you're feeling can be really powerful, I think. Again, that relies on me being your doctor, I guess. So it's quite individual advice. But I really think that kind of my thing is that all people are people. And so if you get to the person rather than the doctor, that's where you're going to have a bigger conversation. And I think
Mm.
that sometimes, you know, people don't treat me like a person, they treat me like a doctor. So yeah, they're just asking me questions and nodding along while I'm giving them an answer that has no value to them and walking off and going away and telling their friends, I went and saw the doctor. They didn't do anything. And that's the most heartbreaking thing for me because I felt like I was doing something, but I wasn't doing what they wanted me to do, which means I should have worked harder in figuring that out. But sometimes we miss those cues. Sometimes there's so much going on in a consultation, and there's time limits and all of that sort of stuff that sometimes, you don't get it right. Um, but I think being able to have that conversation and being able to, explain to someone how you feel. I think also one of the things that worries me, and again, this is not based on any kind of science or anything like that, but there's so much anti-doctor stuff in, social media, and there's so much how, you need to advocate for yourself. And if anyone posts anything about an experience that they've had with a doctor, the comments are like, you need to make a formal complaint. You need to report them to the general. It's so like it's such aggression that sometimes I think people who aren't used to seeking healthcare, who are young, fit, and healthy, and might be going to see a doctor for literally the first time in their life, is already expecting a fight, and they haven't even met the person.
Yeah.
And that can be, I think sometimes we see it a lot with menopause. Like menopausal women are often told, doctors don't know about menopause, doctors don't understand this, your GP is going to be really dismissive of you, they're not going to take you seriously, they're not going to give you what you need. So if you make an appointment with the GP, that's what you're expecting going into the consultation. It's not going to be a fruitful consultation because it's going to be combative from the start, because the minute that they perhaps challenge anything that you might be saying or suggest anything that's outside of the course of what you think should be happening, you might be already feeling like they're not going to give you what you want and this is pointless.
Mm.
Mm.
And there is a difference between, what we want and what we need. But I guess it's just, for me, I really want people to be able to get healthcare, but there are those challenges in there in terms of, I think it's important. I think there is sort of some degree of, perhaps doctor selection. And I'm not a fan of shopping around when it comes to medical professionals, because I think then often you don't want to be kind of pandered to by medical professionals, but you also need to have people that you connect with, or that who at least you feel comfortable talking to.
Mm. I think doctor shopping primarily happens in individuals that are seeking prescriptions that they may otherwise not be right to receive. And I wonder, like, I think there's no appropriate word. I think if you could enter into a doctor's room as a patient and kind of like, even in my space, like de-ego the situation from the very beginning and just say like, hey, I'm looking for a long-term relationship. I'm looking
Yeah,
for someone to support me with the best health
yeah,
outcomes as possible. Acknowledge that I am currently doing these behaviors that aren't exactly the greatest
yeah,
for me,
yeah.
but I'm going to continue to do them for these reasons and they're important to me. And
Mm,
I need somebody to help assist that I don't
yeah,
cause more damage than is necessary.
yeah. I
I,
love
I
that.
can't imagine that a doctor would sit there and go, nah, man, like you're wrong, I'm right.
And if
Like,
they do, that's not the
and if
doctor
they
for
do,
you.
it's not the right doctor. They're
Yeah.
they're obviously there to win the argument and not to necessarily help. Um,
Yeah, and I think it's hard because I think a lot of doctors then, I think again, just to kind of come back on that from the point of view of some doctors, I think some doctors are very scared of appearing to endorse
mm,
behaviors, because then they're worried about what the outcomes will be,
Mm.
even from their colleagues. And I've sort of had it myself, is like in some ways, I think a lot of people worry that by doing health checks and doing all of those things, that you're de facto encouraging the behavior, because you've become an enabler, because
mm,
you've enabled them to stay healthy. And if you didn't let them stay healthy, then they'd be more likely to quit the steroids. So I think, and I don't subscribe to that, by the way. I don't think that that's a good way of thinking. But I think that there is, again, there's a lot of pressure, I think, within healthcare to not prescribe certain drugs because they can be addictive, to really monitor people's use of those drugs because they can be addictive. There's not a lot of pressure on, as in the pressure is often on the doctor, which causes a lot of conflict between doctors and patients, because then you get a lot of people, who genuinely need certain medications, who are getting the third degree every time they request them, and being made to feel like, they're judged as well. So I completely agree with you. I think that that is exactly the right way to approach it with a clinician. But I do think that some clinicians will still be deeply uncomfortable with that. And I think that, again, I would love for those clinicians to maybe listen to this podcast, or,
mm,
because it's a conversation that there's lots of ethical implications, and there's lots of conversations that we have about things. If there's all these grey areas about, particularly about things like, you know, recreational or off-label drugs that people are using, from the quote unquote black market and all of that sort of
Mm.
stuff. So it's a hotbed of debate, I think. But I think that, you have to have a realistic approach. And I worry because healthcare, like everything else, is becoming so protocolized that there's very, very little autonomy left
Mm.
in how kind of people feel it's appropriate to practice, because there's always this fear of like, well, what will other people
Or losing a
think?
license or something like that. Yeah. I think
Yeah.
this, and this is lived experience from me too, man. I've entered a doctor's room before with the intention just to ask for something that I wanted
Yeah,
without creating any kind of backstory as to why I wanted it.
yeah,
And then when I wasn't given what I wanted,
Do you think that you were entitled
I
to it?
clapped back as
yeah,
to like, oh, but you would give this to this person. And it
yeah.
just was, a bad experience. And lived experience is exactly that. So you learn these things, I guess. Mm.
Mm. Yeah, I don't know if this is too big of a can of worms, but I wonder what advice you would have, because I hadn't thought of that point of view until you just mentioned it, to a practitioner who thinks that maybe the right thing to do is to not give support to this person, because really, if I give support to this person, I'm encouraging them to maintain this harmful behavior. But if they say they're going to continue doing it anyway, like what do you do there? What advice might you have for people that are
Yeah,
struggling with this?
I mean, there's a lot of grey areas. Like I've been in situations where, where I've had, there's cases where patients will say, I need you to prescribe me this drug because if you don't prescribe it to me, I'm going to buy it on the black market,
Mm.
and then it could be more dangerous and it could be a higher dose, and then it will be your fault that that I'm doing that. And that's a really, again, another confronting and ethical debate. And I think that's probably, even that question itself is a debate like bigger than the podcast. But I
Yeah.
think that that's kind of one extreme of it. And I think that sometimes people will apply the logic that they might use to that debate to the debate that we're talking about. And I don't think it's the same thing. And I think that, the parallel that I always try and use is with alcohol, because alcohol is a much better understood drug, I think, particularly in the UK, and I'm sure in Australia as well.
Mm.
And that we would never dream of not checking somebody's liver function tests if we knew that they were consuming too much alcohol. It's just an absolute no-brainer. I think that we are also sensitive to the fact that some people don't have any interest in stopping drinking, and we will still check their liver function tests. I think the real difficulty is that when it comes to things like substance misuse support and the services involved in that, all of the treatments that are offered are always designed to help people stop.
Yeah.
And so if I think that's where sometimes people feel the disconnect is that in this, it's a situation very much of, look, I'm not seeing a doctor because I want to stop drinking, like some people might be if they're drinking. I'm seeing a doctor because I want to keep taking this and I want to do it in as safe a way as possible. And I think that's where people get confronted.
Mm.
But I think, again, the advice that I would give is I see our job as clinicians to try and keep people as safe and healthy as possible within the context of the decisions that we're making. I think we need to make sure that those decisions are informed decisions and that they have the capacity to make those decisions when we're discussing them. Um, and I think that that's one of the biggest problems with performance enhancing drug use is I'm not sure that people who consider themselves to be informed about them always are. I think there's definitely a good sector of people who are 100%, but there are also a lot of people who exist in an echo chamber of people that tell them that, as long as they get their bloods done every 3 months or every 6 months, nothing to worry about, and I think that we all know that that's not necessarily the case. Um, and I think that sometimes the I'm getting my bloods done every 3 months, which is a false reassurance that I can absolutely continue to do this safely and I'm at no medical risk, is a problem. And so I think that the key is to, the conversation that I would normally have with a patient about this would be to say, look, I think that the ultimate best practice for optimizing your health would be to stop taking these drugs in a safe way. But these are the potential consequences of you continuing to use them. if you understand those consequences, then of course that's your decision, and I'm never going to be able to stop you. Like I can never force you to wear a seatbelt every time you get into a car, but I can tell you that that would be the best thing to do. But this is what I can do to try and help you monitor the situation. These are the limits of my knowledge. I don't have specialist knowledge on the endocrinological effects of, the hormones you might be taking, and I don't know everything about it. So you might need to seek help from other private sources, but please try and make sure that they are as reputable as possible. And please understand that some of them may not be giving you good information, but I
Mhm.
can't I can't
Mm.
help that. Um, and please also understand that these blood tests aren't the be all and end all of health, and there are other health implications that could happen. But what you do is up to you. But I'm here to listen and to talk to you. And if you do have any problems or any symptoms, I want you to come and talk to me about them, and we can address those as well. And
Okay.
so that's where I see my role, is to try and keep people healthy to the extent that I can within the choices that they're making or within the lifestyles that they have, and to try
Mm.
and encourage them to maybe, like, I think it's my job to say, it would be great, it would be great for your health not to take steroids, but if you've decided that, your competitive career or your profession or your personal preferences outweigh the importance of this advice, or the effects that these things might be having, that's your decision. It's your body to make those decisions. I can only give you advice.
Yeah. I
And I
suppose
think
there's
it's that
also,
having,
sorry.
sorry, I was just going to say, like, I think it's really easy for patients to think they're upsetting their doctor by not listening to them. And so I make it very clear to patients that I don't, the same with anything. Like if I want them to take a cholesterol medication, I don't mind if you don't take it. It's your body, it's your risk, it's your choice. These are the risks, these are the benefits. My recommendation would be to take this medication. You can choose to take it or not. My ego will not suffer if you
Mm.
decide not to. I don't get paid more if you do. Those sorts of things. This
Mm.
is this is your choice. Sorry.
Mm. Oh, I was just going to say that like steroids are obviously causing a problem, but they're also a solution to some people as well. Because you mentioned like if your competitive career is really important, if your preferences, there's also social pressure for guys to look a particular way, and I think social media isn't assisting with that in any way.
Mhm.
And sometimes those bodies can't be achieved without steroids, and it's an unfortunate I think, symptom of social media for a lot of people. But I wanted to ask you for a short list of things that people who take performance enhancing drugs might be able to look out for, like when these things happen. Should you present to a doctor, or when you present to a doctor, what are the things that you should be asking them to overlook or oversee?
I mean, I guess like the basic stuff, like regular blood test monitoring of, liver function tests, full blood count to check for like polycythemia and things like that, and to check their lipids for dyslipidemia, kidney function. But then there's also like the cardiac effects and things like that. And I think it also speaks to what Dean was saying earlier, is that a lot of medical professionals think that steroids is just one thing. But performance enhancing drugs in bodybuilding is, like the range of drugs that people are taking. A coach sent me recently the list of drugs that he has access to, just like for my out of my interest sake. And it's crazy amounts of different stuff that all do these different things. Like I'm not gonna know why. I'm not going to know inherently, as a doctor that doesn't have any interest in fitness. I know this now, but I'm not going to know why a bodybuilder would be using insulin or metformin or irbesartan, or all of these range of drugs that I know to be about certain things, diuretics. Like there's so many different drugs that they could be using. So I think that the first thing that I guess would be sensible to do would be to share with the doctor what it is that you're taking and why you're taking them. But again, I know that a lot of doctors won't react positively to that because it's terrifying. The first time I heard somebody list to me the things that they were taking as performance enhancing drugs, I was like, oh my God, this
Mm.
is this is terrible. And I think that you kind of, then at the same time, a lot of those drugs are drugs that a lot of patients are on, 5, 10 versions of every day, but you just don't know why they're on them or what they are, what it is that is doing for them. And it's just, again, it's just very confronting because it's like sometimes you're a bit like, I can't believe that you've just taken this decision to take this drug, and like even every time I prescribe that drug to somebody, I have to look up the dose and check the side effects and check what drug monitoring, like blood tests I need to do however often, and then they'll be on a register to make sure that they're having those tests all the time, and you're just kind of popping them like it's nothing, and it's really terrifying sometimes. And when you hear sort of some of the things that people are using and the dosages that they're taking them at, it can be really terrifying. So I guess it depends is the answer. But there are, some people need to have things like echocardiograms and stuff like that, depending on things like ECG changes. Um, but again, then you think, there's so many different consequences to so many different things, and I think catching and monitoring things very early is super important. But I also think that one of the things that inherently, like we know that the human body isn't necessarily designed to carry an amount of muscle mass that you might see on a Mr. Olympia stage, for example, right? So there is inherently going to be some risk, regardless of what those monitoring tests are going to be showing. And I think that's where kind of that disconnect is. So I guess, if any cardiac symptoms, palpitations, fast heart rate, which again, you're going to get if you're taking lots of pre-workout and stuff like that, and a lot of the performance enhancing drugs anyway, but it just, I guess, gives you more of a reason to be monitoring them. Any
So, Mike,
symptoms?
could you maybe explain like a palpitation to somebody, or maybe how it would
Sure.
even present? Because I think like flutters and stuff like this, palpitations can
Mhm.
be misunderstood, in that the person's just like, oh yeah, this is just normal. I've had this for like 6 months, because they
Yeah.
experienced it first in the gym, and now they don't realize that experiencing it at home when they're relaxed is very
Yeah.
different. And
Yes.
that's when we can get people into some problems.
Sure. So palpitations is basically an unusually strong awareness of your heartbeat. So actually feeling your heart pounding. Often it can be associated with, either regular rhythm. So you can be pounding but feel normal. It could be pounding but feel irregular. It can be pounding but feel fast. You can just get a flutter in your chest, or people often call them skipped beats or missed beats, but what they usually represent is something called ectopic beats, which are actually extra beats, but because they manifest themselves from a slightly different electric mechanism in the heart, they they don't feel like a beat, or they might miss a pulse in the wrist because they won't form a pulse. And yeah, so that kind of unusual awareness of it, basically,
Mm.
and regardless of the speed. But if it's particularly fast, if it's irregular, anything like that, it just might be a reason to get checked out.
Yeah, I think it's a big one. Um,
For sure.
and that would be like, in and asking for an ECG. And then if the ECG was to determine or diagnose some irregular beats, then it would be further diagnostics into like an echocardiogram to look at the actual function of the heart. And then,
Yeah, potentially. Again, it depends on the causes of it. So, like the way that I would normally investigate palpitations from a medical perspective is I'd normally do an examination, like listen to the heart sounds, check for any murmurs, anything like that, which can mean like valve problems. Not that they would normally cause rhythm issues, but it's just worth checking. And then checking things like blood pressure, and then doing an ECG, a baseline ECG, which often can be completely normal with somebody with palpitations because it's just that their heart is beating and that's fine, but they might not be having the palpitations at that time. Also, blood tests to look at things like thyroid function, which can cause your heart to beat faster or harder or whatever. And also looking at electrolytes and things that could be disturbed. Um, but then also potentially arranging like a heart monitor. So looking at a 24-hour ECG or a 7-day ECG, depending on how frequently the palpitations are happening. Or even, there's been times where I've seen an Apple Watch pick it up better than a 7-day ECG because somebody might get episodes every 3 weeks. So if they have a 7-day ECG, it comes back normal, but they didn't have any episodes while it was happening. It's not super helpful, and particularly in the NHS where they've waited 6 months for that ECG and another 3 months to get the report from it. It's not great value information, but yeah. So I've seen these things be picked up on an Apple Watch ECG as well when it's happening, and you can get little attachments for your iPhone as well where you touch it with your fingers and it gives you an ECG on demand. It's yeah, there's loads of technology that can be used for this kind of stuff. But yeah, and then if there's an abnormality with the rhythm, then you would be wanting usually to do an echocardiogram as well.
Cool.
Technology blows my mind.
Mm.
Absolutely blows my mind.
Yeah, I think that's one that's actually, a bodybuilder who's engaging in behaviors that they know are not great for their health, but they still want to continue it. I think sometimes can bury their heads in the sand for very obvious symptoms that could be problematic because they just prefer to pretend it doesn't exist.
Well, if also they've had bad experiences with medical professions, they might feel helpless to the situation.
Quite possibly, yeah. But like they get into this point and they're like, oof, like I felt that, but they don't really want to say that they felt something different.
Well, they think it's anxiety.
Yeah, but it's like holding a mirror to yourself, like you can go and see a doctor and they can say, hey, by the way, these are all the behavior you're doing wrong, like fix these. But to also do it to yourself is like really difficult,
But I also think it's really fascinating because if you have somebody who is a successful bodybuilder, the likelihood is that they have had to make peace and engage with quite a significant degree of suffering in the gym. They experience pain, they experience joint problems, they experience hunger, they experience, muscular failure itself. When I go to the gym, I'm constantly battling with the voice in my head going, your back doesn't feel right doing that. You're going to hurt yourself. You're going to hurt yourself. You're going to hurt yourself. This is happening to you now. You're slipping a disc right now. All of these things that your shoulder's about to dislocate, put those dumbbells down. All of these things that are kind of in my head. And I guess it's the same thing when a bodybuilder goes to see a doctor. They're being told that in their head, that they're going to have this bad experience. But also, when they're experiencing these things, they're used to shutting them out because they have to shut all of those symptoms off when they're in the gym. So I guess they sometimes just have a very good relationship with pain and suffering and
ignoring it.
But that's 100% why I asked you to talk through what a palpitation was. Because I think a lot of people just don't recognize them being what they are because they're so used to having a pounding heart in the gym. Or like you said, they're using something like high thyroid. They're using something like clenbuterol. They're also stacking it with caffeine. Like they don't know what it's like to be relaxed.
I've just had a light bulb moment that's kind of a side topic, but here we go. I've only ever dated bodybuilders, and I always have this idea that men have really low self-awareness, but maybe it's that bodybuilders have low self-awareness because of what you've just said.
Can I blame that? I think I'm going to take it.
Wow, this is blowing my mind. That's such a good point.
I mean, I guess it's having to shut off your self-awareness because you're constantly getting signals from your body that you shouldn't be doing what you're doing and you're having to ignore them, right?
Fight through it.
Or even on top of it, the amount of times that I have to have conversations with my guys about speaking nicely about themselves to themselves instead of saying that they're a piece of shit and that they look fat and they've got skinny arms and all this sort of stuff. It's like they also have to shut that off though, because like every week they're looking at themselves going, this needs to be fixed, this needs to be fixed. If I just bury myself in darkness of sadness of how shit I look perceptively, then they won't progress. So they are shutting that off too.
Bodybuilders can be really mean to themselves.
It takes a unique individual to be good at that.
There could be Mr. Olympia. Someone looks at an image and goes, yeah, but his carbs are small. And I just think bodybuilding can be really cruel.
It literally happens every professional show. It's like, like you can have a football team compete 36 times in a year and they could be terrible 50% of that and they still have supporters. They're all very mean, especially like in certain countries. But like bodybuilding is like you're standing on stage in nothing, being judged for what is wrong. And like it is brutal. Yeah.
It would be hard to mix the motivation to be better and self-compassion when there's that amount of criticism on you.
And if you are suffering from like an anxiety or something of like, health anxiety, good luck. There's been plenty of bodybuilders that have had to quit because they just couldn't contend with the idea that they might die, due to their behaviors. Um,
Yeah.
so
But do you know what? I hope this isn't too personal to share. Dean was a really successful amateur bodybuilder, absolute Adonis I'm married to. But you always have this discussion, when do we stop this thing that's harmful for my health, but I also really gives me all of these benefits as well. And you mentioned that to be even better again, there was an amount of drugs involved that you just thought might be so harmful to your health, it's not really worth it.
yeah, it was like the juice wasn't worth the squeeze. Is that the saying?
Mind the pun.
Like it. Well, yeah, actually, you would have liked the squeeze, but yeah, like if for me, it was like I understood that what bodybuilding would provide me professionally, or even like from like an yeah, professionally, like how I would do and what would be required to do that wasn't as great as the importance it was for me to live a healthier, like more mobile life.
And your relationships.
Well, this is like in general, like
Yeah.
I was talking to somebody about this just recently, a client of mine who's quit competing as an amateur, and he
Optimal
looks,
quitting?
yeah, for sure, massively, actually, really,
Okay.
really well. But he said to me, like I'm doing this for these reasons similar to mine. And then he recently was kind of like had a blood pressure shift up, and it was because he played around with a high dose of growth hormone. And I said, hey, that might be your limit, and you have to understand that as much as you want to test a greater limit, that if this limit produces this blood pressure, then that comes with some consequences. And he said, oh, look, I probably only really want to push up one more time over the next 12 months. And I went, hang on a minute, like 3 months ago or 2 months ago, you decided that you couldn't be bigger because you thought it was better for your health. Like you need to like have a sit down and consider like
Where are your
what
boundaries?
values and boundaries are important to you. Because I can tell you now, I said, man, I often think I might just get a bit bigger. Oh, I wouldn't mind getting bigger again. And then I think, but at what cost would that come to me? I wouldn't be mobile. I couldn't sit on a bike as much. I would be out of breath. I'd have to eat more food. I'd have to say, maybe I'd even get worse diastasis because of all the food that I have to push in. Like all of these consequences start to rack up, and the values that I live my life by are far more important to me. So,
And I think that's why people struggle so much, because it's when I think people don't often define what success means to them before they set out on a journey. And I think it can go two ways. Either they haven't defined it, and so they relentlessly pursue something until they end up in the ground. And we see it with everything, whether it's with money, material things, work, climbing the career ladder, all of that sort of stuff. They either define it not at all, or they define it too rigidly, and they can't, they've decided that their goal is to, let's say, be on a professional bodybuilding stage. So they have to do that pro prep, they have to do they have to get to the next level, or they haven't scratched the itch. And it's really tough. I think it's genuinely something that I've seen, I guess, again, because I've been around the industry for a little while. I've seen a lot of people come out of the competing and come out of that being their identity and their lifestyle. And I think what's really interesting about it is it seems to have a completely different effect on everybody, because their values, their principles, their definitions of success, and their association of it with their identity is so vastly different. You've got some people who are very happy to step away from it and kind of almost live the passion of it through coaching. And you've got some people who throw themselves into something else instead, like that is, perhaps a different competitive endeavor, but one that they're not as well suited to. So then they struggle with that. And then they struggle with, what happens after that as well. And then you've got people that just continue forever.
mm,
And I think that's why it's so challenging for people, because it is a really identity based sport. Like, you could be a footballer and you can walk into a room and nobody knows that you play football unless you tell them. But if you're a professional bodybuilder, people will notice where, it's not something that's invisible. So it's often associated with so many of the conversations that they have, and so many of the, things like the compliments that they might get. And, a lot of their self-esteem and their validation will come from, being better than other people at this quite unusual thing. It's fascinating to people that aren't involved in it. And it commands respect from people who are involved in it. So, it's constantly being like reinforced, but then they also get these horrible comments on Instagram about their carbs. So, it's a
mm,
real tough terrain, I think, to navigate. And I think it's very hard for people to know when they've had enough. And I think, like, I have huge amounts of respect for people who competitively successful in any field and who pursue success an amazing degree. Like, huge respect for that. But I also have a huge amount of respect for people who know when to stop, who know when it's the right time for them to stop. And I don't think that gets enough credit.
There's a full podcast on this topic called Optimal Quitting. It's either by Freakonomics Radio or No Stupid Questions. I'll find it and put it in the show notes. And if anybody's interested in learning, they call it optimal quitting. I hope I'm not butchering the definition of this, but it's essentially when quitting is the best option, not because you're a failure, but because you got what you wanted out of it and it's no longer serving you. So check out the show notes for that. So, Mike, if you could leave the audience with maybe one thing you wish bodybuilders understood about healthcare, or to healthcare providers, one thing that you wish they knew about bodybuilders, what might that be?
I guess it would be the same advice to both. I guess try and take the ego out of the conversation. Try and accept that there might be some misunderstanding on the other side, and try and come to a more human conversation about where things are at. And if that's not working, then maybe move on, but don't give up. Please try and find a healthcare professional who you can connect with and who can help you. Yeah.
Okay. Now, we love finishing the episodes with a would you rather. Dean, would you like?
I'm waiting for this.
Oh, come on now. There's too much. Would you rather me not take the question and it be good, or
I'll take
me take the question and it would be terrible?
Dean doesn't feel like he's a great would you rather. So before we started recording, you were telling us about your...
I've got one.
Oh, do you?
Yeah.
Go on.
Mike, for those that are watching, would you rather for the next month have to either wear your glasses upside down or shave that mustache so it looked a little bit Hitlery?
I thought that's where you were going.
And you can't take a holiday.
I think I only really have one acceptable choice for that.
I don't know, do you?
The mustache.
No, but let me just pass this out. If I'm a patient and I walk in and your glasses are upside down, I'm not sure if I could trust your opinion.
I literally would walk out of the office.
I will say I legit cannot see. So I'm going to have to
go with the mustache.
Now just go like this for me.
Don't do that.
I have a beard.
That could be a great screenshot. One perhaps that should not be on the internet.
We've got our episode hook right there. That's the clickbait. Mike, we hope to have you on the podcast at least.
Hang on, has he answered? I'm not sure if he's answered.
I think
he said he only has one choice, but I'm really uncertain.
Listen, say it. Politically, I would have the glasses upside down, but in practical reality, I will die because I won't be able to see while I'm driving. I could cause the death of other people as well. So in accordance with the Hippocratic Oath, I don't want to cause anyone any harm. So I would probably have to shave my moustache.
And hope you don't have Jewish patients. Yeah.
So
maybe I just have to take a month off.
Maybe no, you can't do that.
No loophole. No.
Upside down.
There's no time off. If anything, your hours are going up.
It's really difficult.
Have I just learned that
was glasses, the best would you rather?
Have I just learned that glasses don't work when they're upside down?
So I have astigmatism, and so basically every plane is different. So if I wear contact lenses, they have to be tailor-made so that they don't rotate. Because if they rotate, normally contact lenses are just constantly rotating in people's eyes, and it doesn't matter because it's the same in all visions. But because the shape of my cornea is more like a rugby ball than a football, so the plane of distortion is different in every angle. So if someone else wears their glasses upside down, their vision might be absolutely fine. But with somebody with astigmatism, they can't see. I can't see anything with my glasses upside down.
Oh, that is awesome.
So I think maybe here's a compromise. I'd
like you to know we accept no compromises. But
I'd have I'd have the glasses reglazed, so the lenses would be the right way up, but the glasses. So I'd still have the appearance. So I'd look like this, and I'm okay with that.
Do you
That's
know?
better than the moustache thing. But I would have it in a situation where I would be able to see.
Do you know, Mike? Those glasses aren't that far off like a Mrs. Doubtfire. To be fair, you could almost.
I can't do it. I can't take you seriously. Please don't.
I mean, I was going to do my Scottish accent, but
I'm open to a Scottish accent. Can you? Are you good at it?
I mean, I absolutely can, but it's really difficult to do it on the spot.
Yeah.
You need to do it
It's like
freely.
when someone says to a comedian, say something funny.
Mm.
It's like, yeah.
Do you know if you need to, I know that there's certain like trigger word, like people who are good at accents always say like there's trigger phrases that you have to say. So like if you were doing a Northern Irish accent, you'd go, get out of here now, because
Yeah.
that's a sentence that you will definitely get in there, and then you can flow
Continue roll.
into it.
I have a question. Why is it fine and kind of funny and entertaining to do a Northern Irish accent, but to do a Chinese accent, it's kind of racist?
I'll tell you why. Because consistently people have used accents to mock certain cultures.
Okay.
So because over kind of a long period of time, it's the negative connotations of cultural stereotypes basically, and I think those have often been associated with accents. So I think that what's historically happened is that people will use a kind of token or stereotypical East Asian accent to represent certain characters in TV shows and stuff, and for it to be funny, and for it, it's usually at the
expense.
It's usually insulting to the culture.
Yeah. Okay.
I think if somebody was doing an accent because they were playing like a role on TV or something and had to do a voiceover or something and had to do that accent, I don't think it would be necessarily insulting. I think the borders are really blurred, because I think some people find things insulting that I don't think there's any reason to find insulting, and some people don't. I have a Middle Eastern family, as you know, and I am English, but I spent my whole youth making fun of their accents. But it wasn't racist, because they are my race, I suppose, as well. But also, I wasn't using it to belittle them. My mum would always clap back and she would say, "Who taught you how to speak English, you idiot?" I think it often is when I think people often talk about like a power discrepancy, don't they? So like, there's never been, I was going to say, yeah, I think it comes to like cultural persecution and all of that sort of stuff, and whether or not there's actually a power balance between those cultures too. It's a really interesting debate.
Yeah.
But I also think like the Chinese accent is far more foreign, and it's a bit different when it's them attempting to speak English and sounding funny versus the fact that it's just an Irish accent, it's just a Scottish accent, and it's just a British accent.
Yeah, exactly.
That's
true. Yeah. And if you were trying to speak in Mandarin or Cantonese or whatever, you would be trying to speak it in the right accent, and that would be respectful.
Well, this is actually one of the problems that I've had when I've been trying to learn Spanish, is that I feel like I need to act to speak Spanish, but then I feel like I'm being a dick.
Yeah.
But every time that I just relax, I can speak far better. I can enunciate better. I can't speak good Spanish, but I can enunciate better. And this was actually the truth. Funnily enough, on this, we were in Edinburgh, and I jokingly started speaking Spanish in a Scottish accent, and I was so much better.
He actually can speak Spanish way better in a Scottish accent.
And it was because I think I relaxed into this like character.
Mm.
And I'm like, I think I just need to learn to mimic some Spanish character,
Yeah.
And not feel like I'm being rude.
I went to France recently, and it was really interesting because you kind of like, I learnt French at school and I did really well. So like I felt like I knew the words. But then when I did it, I felt like I was doing a bit like, and I was like, oh, and then I almost anglicized, I almost made it more English because that felt less silly. But I was like, why are you doing that? Like, surely you should be trying to pronounce these words correctly. But then, like, I don't know, it's a really.
But I do this all the time. If I'm saying a Spanish word in English, I don't like. I used to joke about people like it always happens for Italian. Like I went down to the shop and I got some pasta. And you're like, hang on a minute. Like, why did you just all of a sudden say pasta? Yeah, bruschetta. Like, was that Russian? I don't know. Anyway, and I do it. I'll be like, oh yeah, carré, instead of carré. And like, but it's because I can't. I'm like, if I'm speaking English, I have to say it like an English person.
Yeah. No, I get it.
Chocolate. Yeah.
All right.
Mike, it's been a pleasure as always.
Likewise.
Thanks to everyone who's listening. Please share this with your friends if you think they will get value from it. 5-star reviews only accepted, 5 or above. And we'll see you in the next episode. Oh, actually, sorry, before we go, Mike, where could people find you if they wanted to hear more of your wonderfulness?
Oh, sure. Dr. Mike II on all of the social media platforms.
Okay, I'll also pop that in the show notes. Okay,
Beautiful.
bye everyone.
Thank you.